We will aim to share the slides after the webinar as well, and if anybody would like and link to the recording, then we can include that as well. So welcome to our event. This makes up part of the Black History Month conference. We can give a link to the full webinars for that conference throughout, but this webinar is focusing specifically on the Jamaican 60th celebratory arts and health event that we used last year. Just some quick housekeeping. If everyone can please stay muted during this webinar. If you want to ask a question, ask it away on the chat. Don't be afraid as well to put your hand up using the raise hand button within Teams, and don't be afraid to take your mic off if you do want to speak. But if you're not speaking, please stay muted during the webinar. If you can turn off any VPNs as well, that would be great to save bandwidth. As I said, use the chat function or raise hand to ask any questions, and we are recording this webinar as well. So how this webinar is going to work, we're going to start off with me just talking about why we chose to do this event. I'm just going to give a bit of a background to the Jamaican 60th anniversary celebration, and then Alex is going to go into each thematic area that we covered. He's going to give some detail about health inequalities that helped us to choose which 5 core health areas we picked. He's also going to talk about what was achieved during the project and some health outcomes that came as a result of the project. So every year on the 6th of August, Jamaicans celebrate Jamaican Independence Day, and last year was the 60th year of independence. And so Public Health commissioned celebration events using arts-based activities to raise awareness around 5 core health areas. Those 5 core health areas were pregnancy, mental health, diabetes, cardiovascular disease, and musculoskeletal disease. We picked those areas for 2 reasons, really. One of those was because they are key areas to cover with the Jamaican community. Another reason is that we had run a similar project with the Bangladeshi community and the Pakistani and Chinese communities as well. And we'd seen that it'd been successful in those communities and wanted to continue similar kind of projects with the Jamaican communities. We have some profiles which we can send a link into the report, and the Jamaican community will be picked up in our Caribbean community health profile. We also have the Black Ear report, which was produced by Birmingham City Council in partnership with Lewisham Council, which covers health inequalities of Black African and Black Caribbean citizens. All the projects were delivered by or in collaboration with community organisations that were Black ethnic led or have extensive experience in engaging with the Black Caribbean community. The projects throughout were flexible. Activities were adapted to what participants felt would be most useful for them. Each project produced artistic outputs with participants that were showcased around the time of Jamaican Independence Day on the 6th of August. And the presentation today will provide you with an overview of each of these projects and how it contributes to the evidence base on how targeted arts and culture activities can be used to address health inequalities in specific communities. We can then discuss how this relates to wider work to address health inequalities in Black Caribbean communities. And Alex is also going to be introducing our new creative public health programme. So that's everything from me. I will now pass you on to Alex, who's going to talk about the thematic areas in a bit more detail.
Hi, everyone. Can everyone hear me all right? So I'm Alex. I'm the Public Health Officer for Arts and Culture in the Communities team. So I'm going to start by talking about the pregnancy projects in the Jamaican 60th celebration. So the first project conducted 7 participatory skills-based workshops with Jamaican women, and these were designed to educate and empower them around pregnancy and maternal health. Maternal health inequalities are significant in the Jamaican community. Black women in the UK are more than 2 times more likely to experience stillbirth than those of the white British ethnicity. This project was delivered by a local community organisation called Communities Engage and Thrive. They partnered with the Blessed Centre, which is a social enterprise based in Newtown in Birmingham, which has a large Jamaican community. The Blessed Centre have a strong and trusting relationship with the Jamaican community, which created a safe space for these sensitive conversations around maternal health. The Blessed Centre has a media studio, and this was used to create podcasts and digital recordings with the participants. And digital storytelling was used to explore their experiences of pregnancy in an emotive and engaging way. The podcast and short film was showed to an audience at the Bless Centre at the end of the project. So during the workshops, midwives and nutritionists from Sandwell Hospital attended, and they were used to provide professional and culturally appropriate information on the health and wellbeing aspects of pregnancy and maternal health. The topics covered in these discussions included the science of being pregnant, such as like the different trimesters, different options for giving birth and how to make informed choices about this, understanding of epidurals and inducing birth, the best types of food to eat pre and post pregnancy and weight management pre and post pregnancy, breastfeeding, birthing partners and post-birth depression. And there was also a group discussion sharing experiences with NHS maternity services. Details were provided to the participants, signposting them to relevant services following the workshops. There were 25 participants in the sessions in total and over 30 at the final showcase. And the participants showed significant improvements in health literacy surrounding pregnancy and confidence in where to go for support. Next slide, please. So the next project was with Communities Engage and Thrive. And this involved partnering with several local churches with strong connections to the Jamaican community to improve the mental health of the local Jamaican community through an interactive educational and fun activity focused on mental well-being. There's substantial mental health inequalities within the Black Caribbean community, and this provided rationale for the activities. For example, Black Caribbean people are significantly more likely to be detained under the Mental Health Act than the white British population. The activities provided participants with different tools that they could use to manage their mental well-being, and it explored its relationship with diet and physical activity. They were themed around Jamaican culture and sought to celebrate the people of Jamaica and their contributions and achievements. The activities included a delivery of a food and mood workshop by a nutritional therapist, in which discussions about the link between food and mood were explored, with options for participants to taste samples, a dance and Jamaican drumming workshop with the aim of uplifting and engaging participants to improve both their mental and physical health through music and dance. There was also a fitness and movement workshop, which used stress balls and resistance bands to support both mental and physical health in an interactive and cohesive manner. There was a healthy drinks and healthy snacks workshop that was aimed at developing knowledge of healthy food options such as turmeric and honey smoothie taster sessions. There were also a series of calmness and reflection workshops that were used. These included an art activity that used rock painting to encourage the process of reflection, workshops that focused on tracing your personal life journey through life maps to recognize strength and resilience, a workshop with a cultural focus upon individuals' journeys from their homeland to the UK. This was supplemented with a showing of a short film on individuals' journeys from homelands. There was also a session where participants created a vision board of their future and were guided through a visualization session, and a group trip to the botanical gardens. So there were lots of mental health and wellbeing sessions in this project. There were around 20 participants from Small Heath Baptist Church, New Testament Church, Church of God of Prophecy, and All Saints Church. The project improved the mental well-being and health awareness of the participants, while allowing them an opportunity to form social connections, reminisce, and celebrate their culture. Next slide, please. I keep forgetting to say that. So the next project was delivered by Legacy West Midlands, and it focused on using drama and role play to improve the capacity of older people from the Jamaican community to engage with health services regarding musculoskeletal conditions. The workshops were intended to address historic issues of healthcare providers misinterpreting the severity of pain experienced by Black patients and difficulties that older adults may experience in navigating contemporary healthcare. So it's been shown that older Black women are at higher risk of death after falling compared to white women. And this provided one of the rationale for this workshop. The drama workshops involved role-playing common scenarios when engaging with healthcare services, such as using the 111 service, interaction with healthcare professionals, navigating digital services, and self-expression of symptoms and pain. This helped address musculoskeletal conditions through early intervention and pain management via earlier reporting and improved communication between individuals and healthcare professionals. The use of drama allows real-world interactions to be explored in a safe, accessible, and fun way. The workshops also included group sharing and storytelling sessions, where participants discussed their experiences of musculoskeletal conditions such as osteoarthritis, rheumatoid arthritis, gout, and lupus.
And I said, you know, I'm giving you a phone yet because I'm still not convinced you out. How did you unmute my things?
Sorry, can I just ask everybody to mute themselves in the chat? Cheers, thank you. And we'll take questions at the end as well, by the way. The workshops also included, oh wait, I've done that bit, one sec. So the workshops also included group sharing and storytelling around participants' experiences of musculoskeletal conditions, such as osteoarthritis, rheumatoid arthritis, gout, and lupus. The participants reported improved skills and confidence in using booking systems, such as the NHS 111 service, and communicating pain verbally and remotely over the phone. Workshops were also an opportunity for participants to celebrate their culture and reconnect with others from their community coming out of the COVID-19 pandemic. So it also helped to address issues such as socialization, isolation among older adults. Next slide, please. So the final project in the Jamaican 60th celebration was delivered by Diverse Nutrition Association. And this was designed to address cardiovascular disease and diabetes in the Jamaican community through practical and culturally appropriate cooking sessions focused on behavioral change. There's a higher incidence of stroke among Black Caribbean ethnic groups, which has also been linked to higher rates of hypertension. There is also higher rates of doctor-diagnosed diabetes in the community. This provided rationale for interventions in these health areas. The guided cooking sessions were focused on making healthier modifications when cooking traditional Jamaican dishes, such as reducing salt, oil, sugar, meat, portion sizes, and changing cooking methods. The project and the cooking sessions were managed by 3 Black Caribbean and Black African women who were registered nutritionists, which allowed them to provide informed and culturally appropriate advice to participants. The facilitators also utilised a specially made African and Caribbean Eat Well guide that they'd created. During the workshops, participants were encouraged to have conversations and share their stories of food and their culture. The workshops and these conversations were recorded and used to create materials to further engage the Jamaican community in healthy cooking. There were 7 attendees across the 2 workshops. The cooking sessions provided an opportunity for participants to learn about the relationship between diet and risk factors for cardiovascular disease and diabetes, such as obesity and hypertension. They also looked at how modifying their cooking could address this, while celebrating their culture through cooking familiar dishes. 90% of the participants involved said they were more confident in using healthy cooking methods following the workshop. So that's all of the projects that were involved in the Jamaican 60th celebration. I'm just going to talk about the impact of them now. Next slide, please. So these projects demonstrate how arts and culture-based activities can be used effectively to educate and empower people about their health in a way that's creative, accessible, and culturally appropriate. Participants' Jamaican heritage was a core aspect of each project. And this showed how we can improve people's health whilst promoting and celebrating their culture. It also clearly shows the benefits of partnering with local community organisations with strong, trusting relationships with underserved communities who face barriers to engaging with health services. For these projects and the broader arts, culture and health programme as a whole, we've utilised the RE-AIM evaluation model. This evaluates projects according to their reach, their effectiveness, adoptions, implementation and maintenance. The framework allows us to assess which interventions are effective with which implementation strategies, but also consider how this is affected by context. It helps us to understand how and why they're effective, who they're effective for, in what settings, and how long they're effective for. The RE-AIM model is useful for replicating and adapting effective interventions to different contexts. It enables us to focus on the impact of different dimensions and outcomes related to populational health. And we can share further information about the RE-AIM framework after the webinar. Next slide, please. Beyond these projects, the communities team have developed a new creative public health programme, which encapsulates arts, culture and heritage approaches to public health. There's a wealth of evidence on the benefits of arts interventions for health, but studies have called for work to be conducted exploring the challenges, opportunities and effects of implementing effective arts, culture and heritage policy and programmes within public health. Birmingham Public Health want to move beyond simply being a funding and commissioning body. They want to move towards building networks and partnerships and developing systems in Birmingham that enable effective arts and health work to happen. This programme aims to promote better integration of health and the arts on both sides. So it wants health policies to incorporate the benefits of creative health, but it also wants arts, culture and heritage organisations to invest in addressing health inequalities in their work and to look at the health and outcomes that are a result of their work. Through the Creative Public Health programme, we aim to strengthen the evidence base on the value of arts, culture and heritage on public health. We also want to foster collaboration between arts organisations and public health initiatives by building relationships between arts organisations at a hyperlocal, local and national level. We want to drive joined up system-based actions in addressing health inequalities through creative health interventions. Another core part of the programme will be commissioning interventions that are valuable and impactful for Birmingham's residents that are most affected by health inequalities. We recognise that evaluation is lacking in a lot of arts and culture programmes, so we want to develop a clear arts and health framework and processes that enable effective governance with providers and evaluation of their projects. We envision that through this programme, Birmingham Public Health can become a leader in the space. So finally, in addition to the Jamaican 60th event, there's a range of other Birmingham Public Health projects that address health inequalities experienced by Black Caribbean communities. Firstly, the Birmingham and Lewisham African and Caribbean Health Inequalities Review, also called Black Year, has been conducted in collaboration with Lewisham Council. This review calls for the Health and Wellbeing. This review calls for the Health and Wellbeing Board and NHS integrated care systems to explicitly recognise structural racism and discrimination as drivers of ill health. It also wants them to systematically identify and address discrimination within systems and practices. It calls for Black African and Black Caribbean individuals and organisations to be engaged in doing this to ensure that community voices and leadership is driving this work. Secondly, the communities team in public health have produced a range of community health profiles, including a Caribbean community health profile, which collates the current evidence on the health inequalities experienced by different communities in Birmingham and in the UK. More information on Black Year and the community health profiles will be shared following the webinar. Okay, so I've covered a lot of information there, and that's the end of the presentation. There's an evaluation form that I'll share in the chat as well, because we'd appreciate your feedback on the webinar. We now have time for questions, if anybody has any.